Governor Shumlin and his administration has been spending a lot of time talking about the need to move away from fee-for-service and pay more based on quality of care. The Medical Society wants to be involved in this discussion, but we want to make sure it's done right. So far, there have been few details as to what would constitute what he describes as an all-payer waiver. However, Green Mountain Care Board Chair Al Golbey has made it clear that he wants the VMS to help him and his colleagues design what would constitute this all-payer waiver. The Medical Society's goals will be to make sure it's solving a clearly articulated problem, and it provides sufficient funds to ensure that physicians can practice and stay here in Vermont and Vermonters receive high-quality care.
So it's early January, and we're beginning to meet the new committee members in the legislature. There's about 40 new legislators that we're beginning to get to know and meet with the committee chairs, and it's January. So a couple things we expect to be coming up in the legislature. One is mental health is still going to be on the table. The issue of patients waiting in emergency departments is continuing to be a fairly serious problem, although the Department of Mental Health says that the wait times are declining. We know from one emergency department that a patient waited for 28 days. Anyway, following up on our resolution at the annual meeting, we met with the Commissioner of Mental Health in mid-December, and we'll be working with VAS and the Commissioner of Mental Health on trying to find solutions to that. The Department of Mental Health is also introducing legislation to update its statutes to make them fit with the mental health system. So we'll be reviewing those and working on that. The other issue I want to talk about on this Montpelier Minute is expert witness standards. We're going to dip into malpractice reform by working with Representative George Till to set some standards for expert witnesses. He's going to be introducing a bill, and it will tighten things up so that expert witnesses will be in the same specialty or will have clinical experience with the issue at hand. A couple other things we'll be keeping an eye on. In the administrative simplification area, we'll be looking at prior authorization, working with the Green Mountain Care Board, and also claim edit standards, continuing to work on that with Colorado. Expected to see some movement on a surrogate consent provision for when patients don't have agents or can't make their own decisions. And we will be working on the Board of Medical Practice investigative standards.
Additional issues that we expect to come up this session are an increase in the tobacco tax on packs of cigarettes of $1.25 and increasing the tax on other tobacco products. Also, the legalization of marijuana and the sugar-sweetened beverage tax hopefully will be back again this year and maybe included in the budget. And working on that is the Alliance for a Healthier Vermont.